This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
It's a common one that people see. We encourage you to call the health district so that we can get out there right away to keep that water fresh, keep it clean. And we also remind folks to dress appropriately so that they can be aware of the mosquitoes that are out there. But I couldn't thank the vector control units from Clark County and the health district enough, because they are quick to respond. They really do yeoman's work. And I also want to point out that mosquitoes don't just impact humans. A lot of animals are impacted by that. So we see throughout the summer that the animals may get bit by one, horses or one in particular that we look out for. So we encourage everybody to do their part and to support keeping water moving, keeping water from being stagnant, to dress appropriate, repellent where you need to, and to do your part. So with that, I'm going to introduce you to Commissioner Gibson, whose district this is, and we'll tell you a lot more about it. So thank you.
Thank you, Commissioner Kirkpatrick. I'm Jim Gibson, the chair of the Clark County Commission, and this is in my district. Community health is such a critical thing, and as everyone knows, it's a shared responsibility. Each of us as individuals has the responsibility to learn and do smart things and take care of ourselves. And of course, our county government is crucial in terms of partnering with the health district and being counseled by them in so many cases to do the right thing and to be responsive to health concerns that may be out in the community. Because of the way that we are so committed, we've come together to create a program that has been in existence for decades. This year, our emphasis is defined by Fight the Bite, which is the moniker we have put on it, in an effort to bring to people's attention how important it is that they communicate with us and that we have what we need to do to help. And here's how we help. At Clark County, we have our own vector control program. And this time of year, it really ramps up with mosquito abatement in unincorporated Clark County. I've learned that our vector control folks at Clark County actually taught Henderson how to do it, used to do it for the whole valley, and they taught the city of Las Vegas about how to do it, and they work together. And you're going to learn something and see something today that will enable you to understand just really what it is that they do. But they are the folks who respond to standing pools of water, and they treat them when necessary. They even do some other really fun things. They set traps for mosquitoes, and they can capture them. When they do, we turn them over to the health district. The health district tests them to see what kind of diseases they're carrying, to make certain that everything we're doing out in the field is responsive and has the opportunity to be seen by those who really know what's going on, so that we can protect everything and all of us in Clark County. They also raise fish in what they call, jokingly, SeaWorld. We'd have a trademark question if they didn't do it jokingly. And at SeaWorld, the fish are raised there, and when necessary, they're taken out to standing pools of water, and they feast on the mosquito larvae, which really is critical to the reproduction of those things. They're made available free of charge to residents and business owners who might have a problem of standing pools of water in their vicinity. Our vector control staff does an incredible job, and we want to give a shout out to them, and also to the Public Response Office, who also see their workload increase because they're the first ones to get the call. But if any of us in our neighborhoods or at work see standing pools of water, this green water is something that we want to make sure you advise us of, so that we can get out and take care of it. And we'll do it as a priority. So these breeding grounds that sometimes are bothersome to people are really something that pose a hazard to us all in Clark County. And we encourage you to report them. You can get online at Fix It Clark County, the app that we have, or you can call 702-455-4191, and that will put you to our response office, and they'll be able to do something really important and effective. And now I'd like to introduce Dr. Furman Ligan, the Chief Health Officer of the Southern Nevada Health District.
Thank you very much, sir. Good morning. Thank you for being here. Yes, my name is Fermin Ligan. I'm the District Health Officer, Southern Nevada Health District. I just want to share with you some history. Actually, in 2004 was the first time that a West Nile virus case in humans was diagnosed here in Clark County, and that actually was the year 2004 when the mosquito surveillance program was created at the Southern Nevada Health District. This mosquito surveillance program developed multiple activities across the county. They do a lot of mosquito surveillance. They set traps to identify mosquito populations in the community, and also very important, they do a lot of education to the public. This education is about protecting against mosquito bites, and also about how to take care of your house in terms of preventing standing water, how to wear long sleeves when you are out, especially during this time of the year. It's important that here in Clark County, once we arrive to this time of the year, springtime, that's when the mosquito population tends to grow. We actually, in the year 2019, had a total of 43 cases diagnosed as a West Nile virus, and unfortunately, 34 of those cases were actually presenting the more severe presentation of the disease, which is the one called neuroinvasive West Nile virus disease. Fortunately, in the last 2-3 years, we haven't reported, diagnosed any case of West Nile virus, but this year, because of the unusual heavy rains in the community, and also the fact that we haven't had cases in the last few years, our expectation is that we might actually have an increase in the number of cases. And because of that, we want to share this message with the community, and also mosquito surveillance in partnership with the county mosquito control unit. They are increasing their activities in terms of surveillance for the mosquito population. As the Commissioner Gibson mentioned before, fighting the bite is a way that we try to disseminate education about mosquito transmitted disease prevention. It has 3 important elements. One of them is making sure that we eliminate standing water in our houses, and that that's something that we can take care of that in our yards, like when you have tires, or we have different tools, throws around your house that actually could help contain water, such as buckets or plants that are not being utilized. Also, swimming pools that are unused or not properly maintained. Those are a very easy target for mosquito population grow. The other element is, of course, preventing the mosquito bite, and that's where we recommend for this period of the year specifically try to wear long sleeves, also pants, the use of repellents just to prevent that mosquito bite. And finally, the third element of this is reporting mosquito activity. That report of mosquito activity could be done through the phone number 702-759-1633, which is the number of the mosquito surveillance program at the health district. Again, the mosquito surveillance unit at the health district do not do mosquito abatement activities, but they conduct surveillance so they can deploy a team to areas where this concern exists and try to identify the mosquito population. It's important to know that mosquitoes are able to transmit multiple diseases. West Nile virus is perhaps the most prominent of them, but also there are multiple encephalitis that are transmitted by mosquitoes both to humans and also animals. And also more recently Zika disease that was identified and reported, especially of concern for young female population, pregnant women that could be affected by the disease. I want to thank you for being here and helping us disseminate this information, and I will ask Mr. Vivek and our partner from the county to do a demonstration. Please.
My name is Christopher Bramley. I'm the Vector Control Supervisor for the Department of Public Works. Vector Control with Public Works works in an abatement program as well as a surveillance program. So we've hung up some of our traps over here to my right so that you can get an idea of weekly types of traps that we use throughout urban Clark County and also in rural Clark County. So we use these at fire stations. We have 3 of them here in the Wetlands Park. They help us identify adult mosquito activity going on in the park and give us an idea of what kind of abatement procedures we should follow through with. As you've heard, there are multiple species in our community, so we have multiple application techniques. Mosquito fish are one of the biggest things that we use. They don't cost the county anything. They save us money on the abatement end. So as Commissioner Gibson was saying, you can get them free by calling the county. We raise them, stock them for people. And we work with Vivek here with the Southern Nevada Health District on his program. So in essence, fighting the bite is a multi-pronged effort by multiple groups within our community. We try to educate everybody that we can. Anybody that needs information, they can call either Vivek or myself. My phone number is 702-455-7543. And you can call there and we'll help you any way we can to mitigate mosquitoes on your property. And Vector Control works in the public right-of-way, so we manage flood control, detention basins, storm drains. We have an underground mosquito abatement program. We manage all of these types of standing water area in our right-of-way, so if you see those types of things, please don't hesitate. Fix-it ticket is probably your quickest, fastest way to do it, but you can also call my office. And after we're done, we have things we can show you throughout the property.
Hey, good morning, all. My name is Vivek Raman. I am the Environmental Health Supervisor with the Health District that looks after the mosquito disease surveillance program. I've worked with Chris for almost 2 decades. One of the real critical things with West Nile and any mosquito-borne disease is to remember that prevention starts at home. So really look in your backyards first and foremost, see if you have mosquito activity. Are there areas in your backyard that they're actually breeding in? prevent mosquitoes from coming into your house, especially in the cooler mornings and evenings like now as we get into summer. Make sure those doors and windows are screened so that they're not coming in and harassing you when you're sleeping. It's little things like that can make a real big difference. West Nile has proven to be very unpredictable, particularly in our valley. In 2019, as Dr. Legend mentioned, we had 43 human cases, and then since then we've had, I think, 1 or 2 human cases reported. So, we never know what to expect in any given mosquito season, and that's why we're here to really try to educate the community about prevention. And as Chris mentioned, we do set traps throughout the valley, so not just unincorporated, but City of Henderson, North Las Vegas, City of Las Vegas, Mesquite, Boulder City. So we work with those counterparts as well to educate them on what kind of mosquito species we're finding, what their disease status might be, so that we can get environmental interventions by Public Works or code enforcement or Parks and Recreation to mitigate those problems, as well as educate the public about bites. Last year, my team set about 2,500 mosquito traps, and we tested over 43,000 mosquitoes. The Southern Nevada Public Health Lab does a fantastic job getting those mosquitoes, testing them, and then reporting those results to us very, very quickly. So it's not just setting the traps, but we have to actually sort through them to look for what are the species. We separate the male from the female mosquitoes, because it's only the females that bite. So there's a lot of prep work that goes into determining what kind of mosquitoes there are and what that disease result is. So we certainly appreciate you being here on a beautiful day like this to help share the message of Fight the Bite. Thank you.
Chris, how many fish did you give out last year?
Over the last 5 years, we've averaged about 68,000 fish that we distribute both to the public and that we put out in flood channels, detention basins, wherever we can put them, and trying to save money on the larvicides that we use. So the program, we initiated the program some 50 years ago. We went to California, and troops before me brought them back in plastic garbage cans. And we started seeding flood channels, and that's where we used to raise them and move them throughout the valley. But that became very cumbersome. It was hard to do, and so Water Rec our county water reclamation district was kind enough to give me a room. There's 16 tanks in it, 250-gallon tanks, and I use 8 of them. So we use that facility to raise the fish. It's time-consuming, but it's a very valuable program for our mosquito abatement program. And again, as I said, anybody can call us to get them if they need them for some kind of issue at their homes. And it's a great program.
Thank you.
Anybody have any questions that they want?
One-on-one interviews.
You've been watching Breaking News from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.